Hey everybody, welcome. I am Dr. Perkins. Welcome to my channel. Today we're talking about, does boric acid treat yeast infections? So in this video, we will dive into boric acid, what it is, how it works, as well as yeast infections and how the two can potentially merge together. We will talk about how to effectively use boric acid, and I'll also review with you the side effects and the potential issues that may arise with boric acid use. All right, so let's talk about boric acid. Not because I'm being paid to do this, because I'm not. I'm going to talk about PhD's boric acid. Boric acid in general is very commonly found on the market, and it doesn't matter the brand really, but it actually comes in like a little capsule. I don't know if you can see that very well. A little capsule usually looks white, and essentially these are used as inserts into the vaginal space. Before we dive in deeper, I do want to make note that you should never, ever put boric acid in your mouth. Okay, these are not capsules to be swallowed. These are capsules that are used and placed in the vaginal space only, all right? Boric acid is actually something that is naturally found in our environment, and it's actually something that has been used in so many different formulations. Like, people are not even realizing that it is in eye solutions that you use in your eyes on a regular basis. Just read the ingredients. It is used in makeup and different types of chemicals that we use on a regular basis. And so it is naturally found. It is used in a ton. But what we do know is that there is evidence-based medicine that supports using it for a yeast infection. Now, a yeast infection is an infection caused by a yeast. A yeast is a fungus, so it's a fungal infection. Now, fungal infections can happen throughout our bodies. We can have it on our skin, and we can have it on our scalp. We can have it under our breast or on our skin, on our bellies. It can be in a variety of places, and also thrush in the mouth. I feel like that's a very common infection. Fungal infections happen all the time. Specifically, when a fungal infection happens in the vaginal area, it is called a yeast infection. Yeast normally lives in the vagina. This is not an infection that arises from somewhere random. It is an overgrowth of the yeast that is already present in your vagina. And so instead of you having 50, for instance, you may have 100 of this yeast. That's an overgrowth. Now, yeast infections are often caused by Candida. Candida is the name of the species, and there are many different kinds of this. So you may find Candida albicans. You may have Candida gibraltar. There's so many different types. It is important to know the kind that you have, but it's more important to be tested to make sure that the type that you have is not resistant. And I'm going to go into that in a little bit more details in a few. Let's talk about the symptoms of yeast infections. Yeast infections oftentimes will be very itchy. Your vulva will be itchy, your vaginal space will be itchy. It may feel very inflamed, and oftentimes you may have a discharge. Commonly, we describe this as cottage cheese-like discharge, but it's not always the case. Sometimes you can have a thicker discharge. Sometimes it could be a thicker white discharge. Sometimes it could be thin and very, very runny, and you may think that it's not a yeast infection, but it actually is. And so there is a large spectrum of what your symptoms may look like, but those are the typical. Now, why is boric acid considered as a treatment option? Well, truly, guidelines use boric acid as a second-line option for yeast infections. First line would be using an antifungal medicine, so like miconazole or turconazole. There's so many of them that you can find both over the counter or prescribed, like diflucan. And so these are different types of antifungal medicines that are very effective in treating a yeast infection. Now, boric acid is listed as a second line option. That means that if you have recurrent yeast infections, it's a great option. If you find that you're not having any relief from treatment with an antifungal, boric acid is a great second option. If you find that your testing show that you have a resistant form of Candida albicans or glabrata, then you can try boric acid as an alternative option. It also means that if you notice that you're having a lot of infections per year, so in a 12-month period of time, you're having 4 or 5 yeast infections, then you may be able to use boric acid as a maintenance medicine to help to reduce the likelihood of getting another. So essentially, the way boric acid works is that it actually breaks apart the cell membranes of this fungus. Essentially, I think of it as just kind of like causing your cells to burst. And so if these fungus are around and it's just way too many, it just pops them all and gets rid of them. Now, boric acid only works locally. Whenever we use that term, it means that it works in the space in which you place it. So if you place it in the vagina, it works in the vagina. If you have a yeast infection on your skin and you place the boric acid in your vagina, it won't help it because it's not a systemic medicine. Antifungals are more systemic. Things that go through your system, it goes through your entire body, that is considered to be systemic. Boric acid is locally used and works locally only. Based on what evidence has shown in medicine, boric acid can actually cure yeast infections about 40 to 100% of the time. That's pretty good as an alternative medicine that is not a prescription-based medicine. It is one to consider using if you're having recurrent yeast infections. Now, how do you use this? Well, if I were to show you my PhD boric acid container again, each of these usually contain about 600 milligrams of boric acid. And that's typically what you'll find on the market. If you insert one of those capsules, which should be around 600 milligrams, in the vaginal space at night for 2 weeks, this should effectively cure your yeast infection. Now, possible side effects include having like really watery discharge. Sometimes you can have some irritation or inflammation of your vulva or some burning that might come along with that. Sometimes that is the medicine or the boric acid working, and sometimes it could be just pure irritation. So in general, you want to kind of weigh the symptoms that you're having and talk to your doctors about them to make sure that this is not an indication for you to not use boric acid at all, or a reaction to the boric acid that is not acceptable. Now, I do want you to know that the biggest exception to the rule is that you do not, and we do not recommend using boric acid during pregnancy. And so outside of pregnancy, talk to your doctor and get the clearance and make sure that you are given the okay to actually use this for your infection. Just to recap before we continue, people that should potentially use boric acid for yeast infection treatment are those who tried an azole or an antifungal and it didn't work, those who have recurrent infections wherein they're having 4 or 5 infections per year, and those who have a non-Candida albicans species, because we found that everything outside of Candida albicans responds very well and sometimes even better to boric acid than to antifungals. Now, lastly, I do want to kind of give some recommendations for just maintenance purposes. If you just want to reduce the likelihood of having a yeast infection, you can still use boric acid vaginally. And the recommendation is to use this once or twice a week at night, just not every single night. And that should help to keep the vaginal space healthy and well so that the likelihood of an overgrowth of yeast is extremely slim. I hope this information makes sense. And so I hope you learned something as well. I think there's another video that would be very helpful in understanding yeast infections and boric acid and other treatment modalities for yeast infection treatment. And so to see this video, click the link in the description, come on over to the next video with me, and let's learn a little bit more. There's so much to teach, so much to learn. I'm Dr. P. Thank you so much for being here, and I'll see you next time.